Hi, this is Sam, teacher Dentist. Welcome back to my YouTube channel. Today we are going to talk about diabetes, which is one of the most popular topics to be asked in competitive exams. Diabetes is basically two types. The first one is type 1, which is insulin dependent, and the second one is type 2, which is non-insulin dependent. While another less commonly known type of diabetes is a glucose intolerance or impaired fasting glucose. This kind of diabetes is basically when the situation does not fit into either type 1 or type 2 diabetes. It is neither insulin dependent nor not insulin dependent. Now, there are also some secondary forms of diabetes, which is due to pancreatitis or drugs such as steroids, which causes diabetes. Another form is gestational diabetes, which is of course during pregnancy. The placenta produces anti-insulin hormone, so there is overall insulin resistance and not sufficient insulin production in the body. So this one slide shows you that whenever you see increased blood glucose level, there could be a variety of reasons behind it and different types of diabetes mellitus that you need to identify before you jump on treatment planning. Let's jump on how would you diagnose diabetes mellitus. So usually a common answer is by observing fasting blood glucose, which is of course the number one way to find out about diabetes. But second one is oral glucose tolerance test, in which the patient is given 75 grams of oral glucose as a challenge, and then their fasting plasma glucose is measured 2 hours after consuming that 75 grams of oral glucose. There are also some variety of symptoms that a patient with diabetes mellitus will show. For example, polyuria, thirst, weight loss, visual blurring, fatigue, abnormal blood glucose during regular test, which was randomly observed, which can trigger diagnosis of diabetes mellitus. Let's learn about fasting blood glucose as well as oral glucose tolerance test. So first, fasting blood glucose. It is the less sensitive but more convenient way. It can be done in a very easier way. Fasting for 8 hours, especially during the sleep, and then when you wake up, you go for a blood test on the fasting state. And the normal value for people without diabetes would be 3.9 to 5.5 millimole per liter. But if there is an impaired fasting glucose, then the level would come to 5.6 to 6.9 millimole per liter. And diabetes is diagnosed when the value is greater than 7 millimole per liter. And that's a very common competitive exam question, that after which value would you diagnose diabetes, which is 7.0 millimole per liter and 2 or more symptoms have occurred. Next test is the oral glucose tolerance test, which is again a very common topic that is being tested in the exams these days. It is more sensitive than the fasting blood glucose, but it is less convenient because you have to give 75 milligrams of glucose to a patient. Now, normally, the value after oral glucose tolerance test would be 7.8 millimole per liter or less than that. But if a patient has some impaired glucose tolerance, then the value would be between the range of 7.8 to 11.1 millimole per liter. And lastly, the diabetes is diagnosed when the value is greater than 11.1 millimole per liter. So the magic number here is going to be 11.1 millimole per liter or more for oral glucose tolerance test, and greater than 7 millimole per liter for fasting blood glucose test. And that's all from Sam at Teacher Dentist. Thank you for watching this video. The next video after this is going to be how can you differentiate between type 1 and type 2 diabetes, all the details about it. So follow along this entire playlist and you will learn for everything about diabetes that is going to be asked in your national board exams. Make sure you subscribe to my channel because I'm really looking for some subscribers. Share this with a friend and also hit that like button so I know that you enjoyed this video. Post in the comment below what are the questions you have and what other topics would you like me to cover in this way. Is this format of video and lecture effective for you, helpful for you? Please let me know in the comment section below. Thank you so much and bye-bye.